Hi, welcome to the Epilepsy Foundation's Dare to Go the Distance, the Epilepsy Journey. My name is Patty Osborne Schaefer, and I'm joined by Dr. Nathan Fountain and Sandy Dewar. This is Getting Diagnosed, kind of our second part on this section. And getting diagnosed means trying to find out, do you have seizures, do you have epilepsy? So I'd like to ask Dr. Fountain to start us off by telling us, how are seizures and epilepsy diagnosed? What are the most common tests that people may have done?
The most common test that people associate with diagnosing seizures is an EEG. An EEG, or electroencephalogram, is a test whereby wires are attached to the head and measure the brainwave activity. And the reason we think about this as part of the diagnosis of epilepsy is because people with epilepsy, with an underlying tendency to seizures, may have a spike in their brainwave activity that happens at any time during the day, not just when they're having a seizure. And so for some people with epilepsy, during an EEG, it may show this spike in brainwave activity that suggests an underlying tendency. But although we think about that as an important test in considering or diagnosing seizures and epilepsy, the most important thing is just the description of the event that someone might provide to their physician. So for physicians, the most important thing is the history, as we would say. That is, how the event's described, the circumstance in which it occurred. And so that means it's really important for an observer of the episodes to accompany the person with epilepsy to see their doctors. They can describe what were they doing when it started, what's the very first thing they noticed, were they aware of what was going on, did they fall down, did they jerk just in one spot or everywhere, did they just stare, and then how long did the episode last? And after it was over, what happened? Did they immediately return to normal, or did they take a while to get back to normal? And once they returned to full awareness, what did they do next? So really the history is the most important thing, but we often think about the EEG. The other important test that often is obtained is an MRI, which is an image of the brain. It's a simple test when someone's rolled inside of what's called a scanner. It's a long tube that someone has to lay still in, and it takes pictures of the brain.
Sandy, what tips do you have for a person on how to explain this diagnosis to family members or their kind of close friends? What do you do when you're given the diagnosis?
Patty, I think ultimately the patient has control over who the information is shared with. There are obvious advantages to family members knowing the diagnosis. Very often the person themselves is not aware of the seizures. People around them are aware of it, and they have a responsibility for keeping the person safe and for caring for them. Unfortunately, a seizure disorder, especially in epilepsy, which is not controlled and may be punctuated by many seizures a month, is not just the patient's medical problem. It becomes a problem for the family too. And I think obviously patients may not wish to tell an employer about seizures, but for family members and people that are close, it's probably better to be open and honest and involve them in the care. In many cases, patients rely completely on family members for access to care, for transportation, and for just day-to-day assistance. And really the family members then, in my mind, are the unsung heroes of patients with epilepsy. So wherever possible, I think it's best to take your family and close friends into confidence.
But I think you summed up very well that epilepsy truly is a family affair, and by involving them with understanding the diagnosis and their care, that might be an important part in that epilepsy journey, and then thinking about what are some of those next steps and who do I tell and why do I need to tell them.
If I might just add, Patty, that
yes,
I'm always surprised when people have this concern about epilepsy that they don't want to tell people, because of course it's what I do all day, all the time. So for me it's no issue whatsoever. It's, some people have asthma, some people have epilepsy. It's nothing of great stigma or concern to me. So I'm always surprised when people have this concern, but I'm also surprised that almost universally, once someone tells their friends or family or employer, almost universally it becomes a non-issue for them. So once they overcome that first step or hurdle, it's surprising how I wouldn't say everybody, but almost everyone feels much better about it. It's just no longer a point of contention or concern for them.
I agree with that. It takes a lot to keep things secret, you know, and sometimes when you're just open about and realize that epilepsy is part of who you are and doesn't define you, and you can talk about it is so important. Well, this is critical part of getting diagnosed, is knowing what tests you might need to do, what's the information your doctor and healthcare team needs, and then how to talk about it. Thank you for joining us on this section of Dare to Go the Distance on your epilepsy journey.